This is CGTN, China Global Television Network.
75 years ago, in the aftermath of the deadliest and most destructive war in human history, the Constitution of the World Health Organization came into force. The nations of the world recognized that health was not only a fundamental human right, but also key to peace and security. Now, while celebrating the achievements of the past 75 years, the WHO Director General also emphasized that there's still much work to be done in healthcare. This week on the program, we look at WHO's role in Africa and the hurdles the continent still faces today in its quest for universal healthcare. I'm Beatrice Marshall. Welcome to Talk Africa. The 75th anniversary is a chance for the WHO to reflect on some of its accomplishments, how past public health issues, including global health emergencies, have been handled, and what more needs to be done for healthcare. The WHO Director General, Dr. Tedros Ghebreyesus, had this to say. Take a look.
The highlight of the 75 years is eradication of smallpox. I think that's a big issue because, as you know, smallpox was a killer. And now we may repeat the same thing because we're on the verge of eradicating polio. But not only that, elimination of malaria is happening in many countries, elimination of many tropical diseases like trypanosomiasis, leishmaniasis is happening in many countries. So there are many highlights.
Well, joining me now to take a closer look at how the World Health Organization has addressed health challenges in Africa are from Brazzaville, Dr. Mary Stevens, WHO Technical Officer, Africa Region. From Pretoria in South Africa, Dr. Angelique Coetzee, Chairperson of the Health Committee, South African United Business Confederation, and former Chairperson of the South African Medical Association. And from Owerri in Nigeria, Dr. Philip Chidi Nchemanze, Chairman of the International Institutes of Advanced Research and Training in Imo State. Thank you very much for joining us on the program, and welcome to Talk Africa. Dr. Stevens, let me start off with you. According to the World Health Organization, Africa experiences more outbreaks and health emergencies than any continent in the world, many of which are actually preventable or controllable with public health interventions. Quantify Africa's disease burden for us. What is a rough outlook of Africa's disease figure?
Yeah, thank you for having me. As you rightly said, the region is mostly affected by health emergencies compared to other regions globally. And every year we receive at least 100 public health emergencies on the continent. And this covers quite a number of range of both outbreaks and humanitarian crises. And some of the most common ones that we have seen recently include cholera, yellow fever, Ebola, and other viral hemorrhagic fevers. And now recently we are dealing with the Marburg outbreak. So the region continues to report these outbreaks year in and year out. But the good news is that we have also seen some improvements in terms of the number of days that the outbreaks are dictated, and also how much time or how long a time is needed to contain these outbreaks.
Dr. Coetzee, I want to get your reaction based on what Dr. Stevens has said there. The region continues to report outbreaks year in, year out. What's been the response of WHO to diseases and illnesses in Africa over the last 75 years? Has it failed or succeeded?
A very difficult question and an important question as well. So the question is not actually whether the World Health Organizations failed in their attempt. It is did the various governments and countries implemented what was being the standard set by the World Health Organization. So we know that the World Health Organization since 1948 already started with campaigns around diseases, non-communicable diseases like TB, malaria, your syphilis or smallpox and leprosy, etc., and polio. Currently, today, as it is, and this we call normally communicable diseases, and if you look at Africa, the highest communicable disease threat is HIV, TB, and malaria, of which there is been announced that GlaxoSmithKline has brought a malaria vaccine on the market that will be tested in Ghana to try to see whether we can reduce the malaria incidences that we see there.
Right.
So yes, they do their work, but it's a team play. It's not only the World Health Organization, it's the countries as well.
Dr. Njamanze, your thoughts here?
Yes, well, I think Africa doesn't have a health crisis. Africa has a governance crisis. And this is the main thing, the determinant factor, that the various governments, while there has been over these 75 years in a few countries, there have been some stability, you could see that most of the governments all across Africa have been in crisis. And when you have a government in crisis, you can't actually run a health system, because who is going to be the custodian? Is it when there are wars, civil wars, or when there are conflicts here with terrorism and all sorts of interventions with normal life? So the problem really, what we should be focused at is actually instituting governance systems that are sustainable, democratic, and making them, with all what is possible, politically viable. This is actually the main thrust of what the WHO can do, in the sense of alerting the whole world that there is an outbreak. But in the real sense of it, the governments around the world, the superpowers, the Security Council, should be more involved in stabilizing the governments in Africa and make sure they help towards combating terrorism and all the things that lead to these violent things. When there is an ungovernable space,
right,
what you will have is disease outbreak.
So, Dr. Steven, how do you respond to that, though, that Africa does not have a health crisis, but rather it is a governance system? How does WHO therefore work with governments and other partners to strengthen health systems and health outcomes?
The primary responsibility actually lies with government to protect the health of the population, and then WHO is there to provide them the needed support, the guidance they require, the policies, and also the capacity building processes. So it's also a joint effort in terms of making sure that the health systems are resilient enough to manage the shock of health emergencies, and also provide services when the systems tend to get overwhelmed, especially during outbreaks like what we have seen with the COVID-19 pandemic. So it's actually a partnership between WHO and government to try to make sure that we prioritize the interventions, but also making sure that we are making investments in trying to address these public health challenges as we continue to mobilize additional external support to strengthen the systems.
Dr. Kotsi, do you find that these strategies that Dr. Stevens is talking about, you find that they are effective in response to Africa's disease systems?
Again, it's a difficult question, because the policies it's very necessary. But sometimes Africa works on their own time, and they've got their own systems. I find it sometimes difficult that we want to and we need to have these policies in place. But the person on the ground, there's the problem. So coming back, we have a HR problem in Africa. We haven't trained the people adequate to use the resources that's there for them. And then bringing a first world kind of solution to a third world system. And I'm not saying that we are backwards or anything. It's just sometimes, people think differently, and you have to take the culture into consideration to get these projects off the ground and these policies in place. And here you have to get community involvement as well. You need to focus more on trained healthcare workers that is trained for the right work. It doesn't help we train very highly skilled healthcare workers because we don't have the facilities to put them in. I'm not talking broadly in Africa. So you need to make sure that the people that you train can bring primary health care to our communities, and we should move away from a curative perspective, but start to focus more on preventative medicine.
Dr. Njimanzi, I want to go back to what Dr. Stevens said earlier on, that the estimate is that there are at least 100 health emergencies per year in Africa. And Dr. Coates talks about the need for curative before the preventative. What do you think is Africa's biggest challenge when it comes to healthcare systems?
As you could see, if you review these outbreaks, they are coming from conflict areas, whether it's in Congo or some other area. It is basically the ballooning statistics in polio is coming from the conflict area with the Boko Haram attacks. So really, ungovernable spaces are places where the disease will usually strike most pronouncedly. But I think over this time, WHO initially from the foundation up to a few years ago relied on local solutions being brought to the international space. So they projected solutions that were actually architected in Nigeria. But for example, in Nigeria, when we talked about using hand washing, simple solution to prevent, there was a very big national program here on hand washing, putting just water in schools and in different places. That had a profound effect on reducing diarrheal diseases. And if you look at the statistics, the diarrheal diseases after these measures were introduced fell significantly, and the deaths fell significantly. And the WHO further developed that, and then of course we added the oral rehydration therapy, which was also very successful. So from the foundation of the WHO, it was really foreseen that the local solutions evolved in the countries will be what will be brought to the international space, and many other people who are in similar situations will learn from it.
So, Dr. Coates, even as we talk about the various solutions for the various communities, there have been some achievements on the continent, as we mentioned earlier on, eradication of smallpox, rinderpest, among others. But others such as polio, malaria, yellow fever, measles are still present in several countries. Why do these diseases continue to linger?
So, one of the problems that we are having in Africa is that about 2% of the medication are being produced on the African continent. The rest are out of being in other countries. So we have the highest burden of disease in those communicable diseases that you have mentioned. So it's always a lack of resources. There was a study done a few years ago, published in 2019, to look at the challenges across the 6 World Health Organization's pillars of healthcare delivery. There again, it came down to say that the biggest problem that we have was inadequate human resources, around about 35%, budgetary allocation to health about 30%, poor leadership management for 8%. So again, why do we still have these diseases? Africa is big, it's vast rural areas, and to get the medication out there is not always so easy. Although I must say that Africa is a very resilient type of people, if we can put it like that. We always make a plan. We try to get the vaccines where it needed to be, but still there's a lot of people, again, regarding to not adequate enough human resources that can't get these services. So if you stay in a urban area, you're much more likely to get services than in the rural areas.
All right, and we will be discussing that issue of resources and budgetary allocation to African health systems in our next segment. But do stay with us now. We're going to take a short break. When we come back, we'll look closer at how Africa can address some of the challenges facing its healthcare systems. Stay with us. Welcome back to Talk Africa. Still with me are Dr. Mary Stevens, Dr. Anjali Kotsi, and Dr. Philip Echidi Njemanze. Before the break, we looked at how the World Health Organization has addressed some of the health challenges in Africa. Let's now discuss what needs to be done to reform the continent's healthcare sector. Dr. Njemanze, there are indications, according to a report by the Africa Health Agenda Commission, that approximately 615 million people in Africa may not be receiving the healthcare services that they need. How equitable is healthcare in Africa, and how do we close this gap?
I actually challenge the number being mentioned because people will get sick and they receive health care, but not necessarily the Western-styled medicine. You see, this is very, very important because the large population, even in Nigeria, still receive the traditional medical care, not necessarily our Western-styled medicine. Now, the issue is how good is that? It's another question in terms of dealing with very serious conditions. But the people are still patronizing the alternative medical care, and actually it is in the majority. The majority of the people still do that. Now, what needs to be done is to rationalize and systematize this alternative care that the bulk of the people still believe in and are using. And until we do that in a very rational way and then just forgo the idea that we will have this construct of Western medicine that everybody must fit into in order to kind of say that it is healthcare. It may not be good for us as a society. We should actually systematize the alternative care in such a way that it works for the people, and it does work, because if it didn't work, you wouldn't be having this whole cycle of patronage for that. People know when they get better from any disease. So I think it is important that we take another look at what is actually called healthcare services. And I believe that number of 615 million is much, much lower than what has been projected. I think it's more, the people are receiving, maybe in Nigeria, I can tell you confidently, over 60 to 70% are receiving care outside the orthodox medicine system.
Right. Dr. Stevens, let me get your view here from the WHO. I mean, what is the approximate number? What is the gap in Africa with those receiving health care on the continent? And what is your view regarding this exploration of alternative medicine?
When we talk about universal health coverage, is to bring healthcare services closer to the people in an affordable way without really subjecting them to financial hardship. And this has been in discussion since 1948, the issue of primary healthcare, and to strengthen those care and make it available and closer to the people. So yes, we know that there are issues in terms of challenges with regards to access, mainly financial, but quite a number of countries have made progress in reducing the cost of medical care. I think from the perspective of what Dr. Philip is saying, the alternative care, one, we can actually do some level of risk communication to try to inform the general public about the availability of the care, but also quality of care. But where they also believe in that alternative care, we have to find a way of linking that alternative care with our primary health care systems.
Right.
They should know that once they get to a certain stage, there has to be some level of interventions that they require, because we don't have all the solutions in the alternative care. It is better to come straight, because if you come very early, then you have a chance of better health outcomes than when you spend a whole lot of time trying to access alternative care, and at the end of the day, you end up in orthodox medicine with complications. So in Africa, yes, alternative care will be there, but we have to find a way of, one, trying to train these people, but also informing the community and making these primary health care services closer to the community, because
Right.
I want to believe that sometimes it's lack of access to this primary health care that is making people go for this alternative care. But we have to bring everybody together for the benefit of the population as a whole,
Right.
because this is what public health is all about, linking everything available and making it safer for people so that we can have better health outcomes.
Dr. Kozi, I'm interested in hearing your perception on this.
We should marry alternative medicine with primary healthcare medicine, and it is to get the right match and the right environment to do this. That's actually should be a way forward. We need to look at private partnership, public-private initiatives. We need to start working together. We need to also, where all your multinational companies, when they extract resources from Africa, we need to encourage them to plow some of those profits back into the healthcare for the communities. Remember, we're talking here about the communities, because most of our problems lie within our human resources, the budget allocation and management. So a lot of it is man-made. It is not disease-made, it's man-made. So, and then again, what I've already said, that the World Health Organization had those 6 building blocks that they developed in 2007. And I think if we look at the 6 blocks, it's service delivery, healthcare, workforce, health information systems, medicines, technology, financing, and leadership. If you can get this right, because this is a basic requirement for good healthcare systems, if you can get this right, as I've said, this is mostly a man-made problem, and not so much a problem made by diseases itself.
Right.
But as I've already said, all these other problems that lead to this.
Right. So I want to get your winding up comments. And Dr. Njomanzi, let me start off with you. As you wind up the program, in your view, though, the response by the World Health Organization on the continent, how has that been? And how do you think healthcare systems in Africa could be more resilient and sustainable in the long term?
Yes, actually, I must commend the World Health Organization. After 75 years, this is one of the more successful international organizations under the UN. And there have been some challenges and there have been a lot of successes. However, I think they should go back to their founding principles of actually using homegrown solutions. For example, they are advocating now, or people are talking about malaria vaccine. Better still, if everybody in Africa or everybody in Nigeria, for example, took the anti-malarial drug at the same time of the year, maybe 4 times of the year, at the same time, what you will have is that the parasite load in every person will be so low that the mosquito, after about a few cycles of the drug, will have no parasite to transmit. And that solution will be easy to implement across any country or across the continent. So I think they should go back to their founding principles of allowing homegrown solutions and then bringing that homegrown solution to the international platform. And I see that the next 75 years will be much more exciting in the sense that there will be a lot of bullet solutions to healthcare problems. However, the simple solutions still will have a lot of place going forward.
Right. Dr. Kodzi, your thoughts?
I also agree that it lies in the simplicity, not in the complexity. We have got lots of work to do. And I would like to stress again, we need to get politicians out of healthcare. They need to be there, but they've got the role. Please leave healthcare to the people working in healthcare. And then accountability, responsibility, HR problems, getting communities to work together, taking hands with different sectors of your communities. It's not only a health issue; it's an environmental issue. It's an issue for social development. There's a lot of work that needs to be done, and we tend to forget that. We tend to focus on the more expensive stuff. It lies in the simplicity. I fully agree with my colleague on that.
All right. Dr. Stevens, you have the final word.
So before giving my final thoughts, I think it will be helpful to also celebrate some of those achievements that we have seen over the last 7.5 decades, particularly for us in Africa. Just to recap, that over the last 2 decades, we have increased life expectancy by 10%. We have also reduced maternal mortality by almost half. New HIV infection has reduced by 44%. And in terms of health emergencies, we are now seeing early detection, which has improved from about average of 17 days from 2016 to now about 3 to 4 days. And the containment, in terms of timeline for containment, now we are seeing outbreaks contained in less than 2 months. Before, if you remember 2016, we have had Ebola outbreak that went on for very long in West African region. So we have seen quite a number of improvement across the continent, including neglected tropical disease. For instance, leprosy is no longer a public health problem for us. About 44 countries on the continent have eradicated guinea worm. We have 3 countries that have eradicated trachoma as a public health issue. So quite a number of some modest achievement on the continent, but we need to do more. We can ramp up our capacity, making sure that the system is resilient enough, both to manage the shocks of emergencies, but also ensuring this universal health coverage, health for everyone, that everyone in the community, even the least a person in the community, is able to access at least primary care at the community level. They can just walk into a primary health center and have access to healthcare, quality healthcare, without really putting them under financial strain. So I think we can improve. So far, so good. Congratulations to the continent in terms of some of the achievements, but we have a whole lot to do, and we can save many more lives with better investment and interventions at the country level, including at the community level.
All right, a lot of work still ahead for the continent indeed. But that's all we have time for on this edition of Talk Africa. A big thank you to all our guests: Dr. Mary Stevens, World Health Organization Technical Officer, Africa Region; Dr. Angelique Kodzi, Chairperson of the Health Committee, South African United Business Confederation, and former Chairperson of the South African Medical Association; and Dr. Philip Chidi Njemanze, Chairman of the International Institutes of Advanced Research and Training in Imo State, Nigeria. Remember, you can be a part of this conversation online through our social media handles on Facebook and Twitter. You can also catch the show on our YouTube playlist. Do keep this conversation going and join us again next week for more Talk Africa. Until next time, from me, Beatrice Marshall. Bye-bye.